how the AI is going to impact the field of medicine. As the AI applications are increasing, there definitely be more impact on the healthcare as well. OpenAI CEO, which is the parent company of ChatGPT, is saying that AI can diagnose better than human, and AI is transforming medicine. And there's already a projection that AI in healthcare will be by within another 2 years will be an industry of around $50 billion. That you cannot rely 100% on whatever AI is saying. So there will be definitely few augmentation of AI which will be there. Hello everyone. So we are back again with one more very informative video. So we have been again getting a lot of messages from the parents and students about after our last video about AI and computer science. We have got queries that they want to also know AI impact on the field of medicine. So in today's video, we are going to talk about how the AI is going to impact the field of medicine. So a lot of news is going on these days on internet, like that OpenAI CEO, which is the parent company of ChatGPT, is saying that AI can diagnose better than human, and AI is transforming medicine. It will happen to this, that. So a lot of things are coming into the picture, because of which many people are getting unsure that how things gonna transform in the future. So first of all, if I talk about today's roadmap, so AI in medicine, yes, there have been some kind of like I said, technology was already there in the field of medicine. If I talk about a lot of automated way of diagnosing the diseases were already little bit part of the research was already happening. In fact, I remember 15 years back, one of my friend when they were in college, they were also doing a project of this image processing in which they were able to they have a lot of medical scanners image and they are trying to find out what stage of cancer it was based on that. So anyhow, right now the field of medicine, especially in India, there are already a lot of technologies coming. There are a lot of machines, lot of devices which help us to diagnose things better. But yes, as the AI applications are increasing, there definitely be more impact on the healthcare as well. And definitely the job landscape are gonna change. So in fact, a lot of courses. So I think 2 days back, I was just going through Udemy, which is also online course platform. So there I also saw that a lot of courses have already started coming in, which is about application of AI in healthcare. Now, if I talk about AI in medical sciences, so definitely with AI, a lot of complicated algorithm will start coming in, which will help to diagnose the diseases or maybe find out a lot of reasons, and all of those will start already coming in. And there's already a projection that AI in healthcare will be by within another 2 years will be an industry of around $50 billion. So now if I talk about how it's going to impact the current medicine field. So basically, there have been a lot of news coming, okay, that with AI, this role of doctor will go away, that role of doctor will go away. But we do not believe anything like that gonna happen, because AI is something which is not accurate. See, even if we now, if you go to Chat GPT and try to search few things, we cannot rely 100% on whatever Chat GPT says. It creates. That doesn't mean that it's something truthful. In fact, the CEO of OpenAI, which is the parent company of ChatGPT, Sam Altman, he himself have told few days back in his interview that you cannot rely 100% on whatever AI is saying, because human need to have their own reasoning and they need to verify that whether it will be exactly correct or not. So here comes the important role of doctor, that a doctor have a lot of experience. They have a lot of experience. They have seen a lot of diseases. They have like worked upon with a lot of humans, surgeries. So the thing is, we cannot directly rely just on AI. Definitely, AI will be like a co-pilot, or you can say it will be like a helping hand, which will started coming in. But saying that it will replace the job of doctor, we do not feel that's gonna happen anytime in the near future, because it's very important. See, especially healthcare, you cannot take risk like if AI said that this is happening, you can just directly to start doing it. In fact, one of my friend have this habit that whenever he feels that he's getting a headache or something is happening, he'll go to Google, and if you do too much research, there'll be too much paranoia which will start happening, because there is no verification, there is no expert advice behind that. Whereas if I talk about doctors, medical practitioners, they have gone through a lot of study. they have earned their license, they have worked with real human beings. So definitely their role is going to be very, very crucial. Yes, but with advent of AI, I will say that it will be become like a new tool. So, like in fact, same thing was said by the OpenAI CEO Sam Altman, that when calculator came, it's not like calculator removed the entire maths. It's not like calculator removed the entire algebra. It just became just another tool, which will help you to sometimes do things faster. So same thing with AI. AI will also become a tool which will help us to maybe understand the X-rays, the MRIs, those things a little in a better way. That's it. So similarly, if we talk about maybe the basic things like treatment, incision, all of that, like maybe those things which are not critical. So those kind of things, maybe it might give you a suggestion and advice, but definitely AI cannot replace the work of a doctor, because human life is very precious. We cannot based on just a machine thinking that this thing happens. Now, if I talk about some of the benefit which is claimed by a lot of research, so basically these all things we have got from Google. So definitely they are saying that there are 16% reduction in diagnosing errors, 13% decrease in treatment errors, 50% faster image analysis. So yes, because a lot of field of medicine depends on scan. Let's say you're doing X-ray, MRI scan. So in fact, all those machine also gives you some kind of generated report. So maybe those quality of reports might improve, just like any other software, right? Maybe if I talk about 20 year back, the computer or the laptops were not that good, but now their efficiency is increased. So it's just that we had a tool, that tool will become a better tool. And with that, it will be, I'll say that the work of doctors will become even more, I'll say, or basically they'll have a better co-pilot. So, but yes, whereas there are a lot of challenges as well as there are a lot of privacy concern as well. So if I talk about role of automation risk, so basically medical coding position, those kind of things will be on risk. Maybe routine diagnostics test tasks can be automated, administrative role can be automated, but simultaneously there are some concern about AI usage, because let's say if what exactly happens in AI, because they train a model. So let's say they'll collect all the data, they'll train the model, and based on that they'll give information. So one major concern is about the data security and confidentiality concern. So for example, if I'm using AI to go through the reports of a certain patient, so it is highly possible that that AI model will take away all the data, and that data might somewhere be available to other people as well. Similarly, there will be issue of consent, AI assisted care, liability, accountability. So for example, let's say AI says that this is the issue, but who is the one responsible if that is not the issue? So there are a lot of concerns, because of which we do not think that AI is anyhow going to soon replace anything in the field of medicine. But yes, as the job landscape is evolving, so there will be definitely a few augmentation of AI which will be there. So especially for a lot of solo practitioner, like it can help in decision making, manual documentation. So yes, it will not be able to full replacement, but AI can relocate some kind of routine task, so that doctor will not be able to waste their time, or maybe not waste, but they'll be able to save their time better to work on the more meaningful things, like on decision making, what exactly the error, maybe informing the patients better. So yes, it will be a support, but it will not replace the job as claimed by some of the news articles. And yes, so in fact, my suggestion to all those aspirants, or maybe those who are in college right now, is that make sure that you have some kind of awareness about it. Maybe you can have more awareness about this digital health literacy, like how data analytics fundamentals, electronic health record optimization. So these are some skills which I think will get essential with time. Just like if I say 40 year back, there was no use of computers in the field of medicine. Now, if you go to any doctor, you'll see they're using computer to maybe create a prescription, or to create a report, or to keep the data of the patient. So those kind of basic literacy is required for everyone. Similarly, you should have basic AI literacy about machine learning, what is actually natural language processing. Because if AI is giving you, sometime it might give you wrong things. So you as a doctor should have the discretion to understand, okay, this might be wrong. What can be the reason? Similarly, because AI is trained on some data set about which we do not know, so there can be some bias, there can be some problem with the algorithm. So they need to have some idea about the ethical reasoning, and a lot of interdisciplinary collaboration. So these kind of are the basic skills that everyone is required. So as I showed in the beginning of this video that you can see some courses are there in Udemy. So maybe you can just know about all these things a little bit, like what is the basic things. And yes, in terms of training and curriculum, it has already started in few countries. They've already started some kind of AI modules in the curriculum, and maybe there'll be some hands-on workshop, specialized electives. So all these things are coming slowly, slowly into this field. And I will say that maybe for all the aspirants, that they can also go through, like, it's not aspirants, those who are in the college, that maybe also you can go through all of this just to have an idea. It's not like it's gonna change anything, but the more idea you have about technology, the easier will be the adoption when it comes later on. Now, all this data are based on whatever we have got through a lot of interviews of some doctors or those who are working in collaboration with the field of AI as well as in the field of medicine. So a lot of healthcare institutions now are launching small scale AI pilot program. They're establishing ethical review board for the AI tool. So basically the AI agents, they call it AI agents. So that is also becoming quite popular in like healthcare institution wise. And basically right now they're in the form of correcting systematic feedbacks, and they're just like an early adopter. For individual clinic, a lot of them have like, I'll say that maybe you can start getting some idea about the AI healthcare courses, attend some interdisciplinary health hackathons and so on. And for the policymaker, they need to develop a clear AI guidelines, create development standards, because then again, medicine is something very critical, and it is not a field where we can take risk, because the risk can cause like human life. So anyhow, we do not feel that AI is going to replace any kind of medical professional jobs. Maybe some clerical job, it will become a better tool. Maybe some diagnostic things, it might become a better tool. So that's it. And for the future outlook, yes, like there will be some AI driven labs or therapies which might be their genetic profiling, medical history. So it will be more like record keeping, and there'll be more like remote monitoring. So for example, let's say if someone is admitted in a hospital, so you'll see there'll be constant monitoring of oxygen level, or some devices will be there. So maybe in that way it's gonna help out in a better way. So this is all in this video, and you can, if you have any further query, you can comment below. We'll get back to you. So thank you all, and see you in the next video.